Hello, everyone. This is Suzanne Weichel with the Center for Law and Social Policy. Thank you for joining us today. We're going to give it just a couple more minutes to see if some more people join in, and then we will begin the presentation. Hello, good afternoon to those of you that were at afternoon, and good morning to those of you that may still be in morning mode. This is Suzanne Weichel with the Center for Law and Social Policy, and we're very pleased that you're joining us today for this webinar on seamless renewals, using existing data to renew benefits and prevent coverage gaps. For those of you who may not be familiar with CLASP, the Center for Law and Social Policy advocates for public policies and programs at the federal, state, and local levels that reduce poverty, help low-income people become self-sufficient, and create ladders to opportunity for all. Today's webinar is part of our Advancing Strategies to Align Programs project, which we work with in partnership with the Center on Budget and Policy Priorities. In our ASAP project, we've been working with state advocates to address issues around streamlining enrollment and retention in work support programs, with specific emphasis on Medicaid and SNAP. And today we're excited to take the conversation to a larger audience across the country. If you'd like to learn more about the ASAP project, you can learn more through the CLASP website at clasp.org. And also a recording of this webinar will be posted on that website within a couple of days. Next slide. So a little bit of context before we get to our experts from Georgetown Center on Families and the Center on Budget and Policy Priorities. So today we're here to talk about renewals with a specific emphasis on Medicaid and SNAP. And the reason we're having this conversation is because we know that the time of renewal or recertification is a time when the majority of churn occurs. And in this context, we're defining churn as what happens when someone who is eligible for a program becomes disconnected from the program and then reapplies and re-enrolls in the program. So the key thing to keep in mind today when we talk about churn is that we're talking about people who never lose eligibility for a program but still experience a gap in enrollment, and what opportunities that states have to eliminate the chance that people are experiencing a gap in enrollment without losing eligibility. So just a little bit about the costs of churn. This data comes from an Urban Institute report from 2014 on SNAP and churn that finds that the SNAP churn rate is between 17 and 28%. And we also know that churn is costly to clients. On the screen are just two examples of the cost to clients, but we know that churn has other costs as well, such as when participants go without needed benefits, increased anxiety for participants, lost economic benefit for the community, decreased participation in programs, and as we mentioned, gaps in coverage. In addition to being costly to clients, churn is also very costly to state when it comes to administering the programs. On average, the study found that it costs $80 more to complete a full application than a renewal application. And it creates a lot of unnecessary paperwork and costs for the state, and it takes time away from caseworkers because they can't spend that time working on perhaps more complex cases and solving other programs. And then importantly, the study also found that when people were turning on and off SNAP, they were disconnected from the program for 1 month or less. So we're really talking about a very short gap of enrollment, which makes the conversation about how to prevent that even more necessary. We know that a large driver of churn is missing verifications or paperwork. And oftentimes this is viewed as the fault of the client or as an inevitable part of the process. But what we've learned from our ASAP project and a previous project called Work Support Strategies is that there are many things states can do to reduce the likelihood that missing paperwork causes churn. And doing so is in the state's best interest because, as we have discussed, it's more cost and time efficient for states to complete renewals than process full applications when someone reapplies after being disconnected from a program. So 2 key questions that states and advocates should be asking. 1, is the paperwork necessary? And 2, are there other ways the state can verify the information? And the 2 experts today will be talking about 2 different state options that can be done to help reduce the churn, particularly ex parte renewals and coordinating between SNAP and Medicaid. And then lastly, we have a graph here. This is a draft slide. This will be coming out in a presentation and a paper next week from the Urban Institute that has results of the project I mentioned, Work Support Strategies, that shows what can happen to churn when some of these steps are taken. And you can see in the bright red line there that Idaho experienced a very drastic reduction in their churn rate once some of these policies were adopted. So please keep an eye out for that report as it is released next week. The rest of today's presentation will focus on the 2 strategies of ex parte renewals and coordinating between SNAP and Medicaid. With that, I'll hand it over to Tricia Brooks, Senior Fellow at the Georgetown Center for Children and Families, who will discuss using ex parte renewals for Medicaid.
Thanks, and you can go ahead and advance it to the next slide. Well, hello everyone, and thanks to CLASP for inviting me to participate in this webinar. I will call attention to the fact, and I think that was in your announcement of the webinar, that along with my co-author, Dr. Jean Lewitt, we put out an ex parte brief, and much of this presentation is based on that. So let's dig into ex parte. What does that really mean? Under the Affordable Care Act, the rules for ex parte are not optional, actually. And when Suzanne mentioned it's a state option, how well states do it is somewhat optional, but the fact that they should be doing ex parte renewals is mandated under the ACA. And that is that states must make a redetermination of eligibility for Medicaid or CHIP without requiring the individual to respond to a notice or a request for information if they can find reliable information either in the individual's account or in data sources that are available to them that might include things like the state wage information database or the state labor database, the unemployment database, Social Security Administration, as well as other sources. Next slide, please. Ex parte is not new. The reality is that ex parte has been required for more than 20 years, but there was a little bit of a difference that was extremely meaningful in the ACA, and that is that ex parte is intended to be done without up front now, whereas in the past it was sort of the step before closing a case, that if you had attempted to renew someone, they didn't respond to the renewal, that you were supposed to look at other sources of information to see if you could renew them. But the fact of it is that states were not totally in compliance with that requirement even previously. So the ACA really modernizes the rule by making it explicitly a requirement to conduct the review prior to sending a renewal form. And then the federal government supports that effort by providing 90% federal funding for the kinds of automated systems that are really needed to make ex parte work well. Next slide, please. So in the definition that I showed on the first slide, I wanted to call your attention to the fact that there are a couple of different ways that you can do ex parte, or different processes that would qualify as ex parte. One of those was using information available from your current data sources. And that's what I think a lot of people think of ex parte, is that someone's coming up for renewal, the state has information on them, like their social security number, their name, their address. They go out and they tap the state wage data, state unemployment data, SSA, to gather current information about income to determine whether the persons in the household remain eligible or not. The second way to do ex parte is to use express line eligibility. Now, express line eligibility is something of a simplified version of the SNAP strategy that Jen is going to talk about extensively after I'm done, but it is relying on the findings in other public programs to renew or either enroll a new applicant or to renew eligibility for children. The problem with express line eligibility is that it was initially authorized for 5 years when CHIP was reauthorized in 2009. Since then, it has been extended several times, but because it's extended for a year or two at a time, I think states are reluctant to pick up express lane without knowing that it is a permanent option that's available to them. The third way to do ex parte is actually, I think, one of the better ways, but we've not necessarily seen states doing a lot in this area. But I will specifically refer to Louisiana, which has really pioneered administrative renewals. And this goes back to the definition of ex parte about information existing in the file. And so Louisiana has gone through, and this is many years ago because I wrote a brief, I believe in 2009, on their experience, has gone through a very significant analytical process to determine if there are cases in the caseload that continue to renew year after year after year without really any changes in circumstances. So, for example, a child that lives in a household where the custodian's income doesn't count, a household where the only income source is child support, and it's been that way for several years. So there are definitely some ways that you can sort of slice and dice your caseload and have reasonable certainty that these family circumstances are stable, and that why not go ahead and renew those individuals, because when you do that, you send them a notice and it says, if your circumstances have changed, you need to let us know. So it's a very safe way, I think, to do ex parte renewals as well. But again, not one that's been picked up by a lot of states. One of the things you will hear from states is concern over program integrity, and I will point out that Louisiana has one of the lowest error rates in terms of eligibility determinations in the country. So it certainly illustrates that this can be done. Next slide, please. This slide I'm not going to go into in any great detail. I just wanted you to have the basic flow chart, which shows how states should be conducting ex parte renewals. So the path on the left, and I see that the Mac to PC conversion here dropped off a little bit of the data in the header, but hopefully we can get a PDF of that for you so that you won't, so you'll have it intact if you want to look at it, but it wraps SNAP in that first header from the top blue box. But the left-hand flow of data says the state goes out, looks at these data sources, or does an administrative renewal, confirms eligibility, and sends that notice that you're good to go for another year. And as long as the individual doesn't report any inaccuracy or change, they're good. That's it. It's a done deal. On the other hand, if the data doesn't confirm ongoing eligibility, the state is expected to send a pre-populated renewal form and give the enrollee up to 30 days to provide the information through the 4 channels that individuals are supposed to be able to apply through or renew through: online, over the phone, in person, or through the mail. And then there are different paths. If enrollees respond to the information, their eligibility can be verified. If they don't respond, then they can be terminated, except that there is a 90-day reconsideration period. And so if someone doesn't respond within the 30 days, but does respond within the 90 days, then the state must reconsider eligibility and not require the individual to reapply at that point. Next slide, please. Now, as part of our 50-state survey that we conduct with the Kaiser Commission on Medicaid and the Uninsured, we asked last fall about the status of ex parte renewals in the states. I will tell you that I think some of this data is not as accurate as we would like it to be, because states have different definitions of ex parte that they're working from. And I don't think all of the states have yet embraced the concept that ex parte means that you renew someone without them having to take action. So, you know, we are going to try to zero in a little bit more definitively on that in this year's survey to try to get better sense of where states were. But 2/3 of the states did tell us that they were able to process ex parte renewals. We asked them about what share of your caseload were you renewing on an ex parte basis, and you can see there's a range there, but several states were indicating that they were seeing more than half of their caseload. In the case of last year's report, 10 states reported that at least half of their caseloads were being renewed via ex parte. One of the big concerns, and I'll talk more about it in just a moment, is that the process is not always automated. So when it requires caseworker intervention, it's not necessarily having the kind of impact on efficiency and administrative costs that it might not be. And as I mentioned, you know, states inconsistently apply policy, and I think that there's more work to be done to make sure they're in line with the expectations of the policy going forward. Next slide, please. So I want to talk a little bit about those state challenges. The first being technology. The ACA implementation was certainly a heavy lift. It took much longer than was expected. Some of that was because a few states may have dragged their feet a little bit, hoping that the Supreme Court would rule against the ACA. And some of it was just, you know, trying to understand the rules, unpack those rules, figure out what your business processes were going to be. Many states talk about that implementing new technology was, you know, flying the plane when you were building it, because you were developing new procedures and new policies that didn't exist while you were building the technology to do that. But we also know that culture change has a lot to do with this, and that when eligibility is decentralized, you will find a variation in how states implement policy from office to office. And that, you know, is something we've grappled with for many years in Medicaid and CHIP, in consistency in how policy is implemented. States also cite unclear or conflicting federal guidance. Am I with you? Somebody else on the webinar?
We can hear you, Tricia. I think you just got a little bit quieter. Yes.
Yep. You with me now?
Yes, that sounds great.
Okay, I'm very sorry about that. For some reason, my headphone bleeped out for a moment. We find this unclear or conflicting federal guidance is more often in a state-based marketplace state where certain rules in the marketplace are somewhat different than they are in the, like, the conflicting, like reasonable compatibility standards, which I'll talk about in just a moment. But that's sometimes a problem. And then the state ability to deal with risk. How much risk do they want to deal with affects their approach to eligibility verification. Next slide, please. And I think this is my last slide before we turn it over to Jen. Just want to talk a little bit about how states approach this and what flexibilities they do or don't have and what opportunities there are for particularly the advocacy community to promote retention. So the data sources that states use matter a lot. Some states prefer the more current state wage data, or even the talk number, which might be even more current than state wage data, whereas other states are willing to deal with the lag that is offered through the IRS data, for example. The level of automation is huge, and then all of those alternative strategies, which road do you choose to go down in terms of implementing ex parte? Reasonable compatibility, and I should have said this up front, this, both what Jen and I are going to talk about and in terms of ex parte and the SNAP strategy are extremely weedy areas to get involved in. And reasonable compatibility is one of those whereby the federal government has said, data is never going to be a perfect match if you're trying to look at sources of data. But it doesn't have to be a perfect match, because if what the individual tells you they earn and what the data source both shows them either below the Medicaid or CHIP cutoff or above, then you don't have to reconcile the difference. But reasonable compatibility allows states to go a little bit further and say, well, what if I want a cushion? And many states have set a cushion of 10%. So that if the individual is, if the individual has income that is above the cutoff, but the difference between what they report and the data source is no more than 10%, they still get determined eligible. So that's an important piece. What constitutes a match? States are not certain, where they are in agreement in terms of if this data source matches what the individual has reported. And then, as I mentioned earlier, the amount of risk that a state is willing to tolerate. More importantly, I think these items on the left side of the screen here will feel much more familiar to advocates in the community. First of all, one of the best ways to promote retention is through 12-month continuous eligibility. That's a policy that is offered for children and can, with a very simplified waiver, be offered to parents and adults. Montana and California, Montana and New York have both picked that up for parents. Suzanne mentioned at the very beginning better renewal notices. If people don't understand a renewal notice, they don't know how to reply. But also not just sending one notice, sending multiple reminders, helping to increase the use of online functions, which make it easier for people to respond. I mentioned previously that during renewals, you have to have a 90-day reconsideration period. States can actually reinstate coverage retroactively to when the individual lost it. Then lastly, engaging community partners, providers, and plans in the effort can all go a long way to improve retention. And with that, I'm going to throw it back to Suzanne and Jen, I guess.
Thank you, Tricia. That was really excellent information. As a reminder to everyone on the webinar, you can submit questions through the chat feature on the webinar, and we will get to questions as soon as we hear from our next expert, which is Jennifer Wagner, a Senior Policy Analyst at the Center on Budget and Policy Priorities. And Jen, I will hand it off to you.
Great. Thank you so much. So I am going to build a little bit on what Tricia was talking about and talk about how you build all the things that she was talking about into cases that have Medicaid and SNAP, again with the same idea of streamlining renewals and finding ways to reduce churn. So we have talked a lot about Medicaid policy, but there's also renewal policy for SNAP that comes into play when we're talking about coordination. So SNAP has a generally different philosophy towards renewals than Medicaid. Anybody who's deep in this world knows very well that they approach renewals very differently. Under SNAP, households have to actually sign and return a renewal form. It is considered a new application that must be submitted when a family's certification period expires. There is no such thing as ex parte under SNAP, which makes it a little bit hard to coordinate, but there are still opportunities. In addition, for SNAP, most households have to complete an interview every 12 months. So there is more interaction with the state agency. Even though that interview can be by phone, doesn't have to be in person, there is more interaction required. So how long is a SNAP certification period? It varies a little bit by state and population, but generally speaking, households with non-elderly or non-disabled adults have a 6-month certification period or a 12-month certification period with an interim or a periodic report at 6 months. So this is the bulk of the SNAP recipients and the bulk of the overlap between SNAP and Medicaid, and notice that there is some contact between the state and the individual every 6 months, whereas Medicaid, it's every 12 months. There are situations where the households have all adult members are elderly or disabled, and then they can have a 12-month certification period or a 24-month certification period with a 12-month interim or periodic report. And even under a certain type of pilot, an elderly simplified application project, they can actually have a 36-month certification period. And then, of course, to make things extra complicated, there are special populations, for example, able-bodied adults without dependents, that may have shorter certification periods for various reasons. But again, the bulk of the ones we're going to talk about have that 6-month certification or that 12-month certification with the 6-month interim report. So why are we talking about this? Why does it matter? Well, the fact is that there is tremendous program overlap between SNAP and Medicaid. 98% of non-seniors eligible for SNAP are also eligible for Medicaid in expansion states. And 63% of non-seniors eligible for Medicaid are eligible for SNAP. So you can see that there are tons of people receiving both of these programs. And sometimes states administer them together, sometimes they administer them separately, but there are a lot of individuals who are receiving both programs, so it's important to look at ways to make it easier for both the client and for the state as they administer these programs. So why are we talking about this now? People have received SNAP and Medicaid for many years. Obviously, states that have expanded Medicaid have a little more overlap now than they used to, but there's always been a lot of overlap in this population. Well, coordinating SNAP and Medicaid renewals used to be pretty straightforward. Basically, states aimed to synchronize certification periods. They tried to make it so that the SNAP and the Medicaid expire the same month. The state would then send one form and require that participants sign and return that form and process for both programs. So synchronization of certification periods was the key to coordination. But now things have gotten complicated. As Tricia described, Medicaid now requires an ex parte review, and that has to actually be done before these renewal forms are sent. So you can't just send the form and ask for it back. This ex parte has to happen first. Also, MAGI rules exacerbate the differences between these programs. Differences in household composition and income counting make states have to kind of rethink how they're gathering this information from the clients. And again, as Tricia pointed out, new eligibility systems, complete blessing and curse all at the same time. They offer a lot of potential to make things better, but also it requires that some things that may have been working in an old system have to be reprogrammed into a new system, as well as bugs being worked out and all those additional complications. But our overall goal here when you're looking at coordinating these renewals is to reduce procedural denials. As Suzanne mentioned at the beginning, there are some people whose income actually changes and they're no longer eligible, and then they might change and come back on later. That's to be expected. But what we're really focused on is the folks who remain eligible, but something happens. They don't return a form, the state doesn't work something that they sent in, and it leads them to be denied even though they remain eligible. So what can we do to coordinate these renewals? First, let's consider what happens when we don't coordinate these renewals and the burden that falls on households. So if you have a process that is not coordinated at all, let's say a family applies for and is approved for SNAP and Medicaid in the first month. Well, around month 5, they receive a SNAP redetermination notice that they have to complete and return with verification of income. Around month 10, they might receive Medicaid renewal information, requiring them to sign a form or to return a form with verification of income. And then just 1 month later, they'll receive another SNAP renewal notice that they have to complete and return with verification of income. So this is tremendous burden on a client who has to constantly be interacting with a state agency to verify their eligibility. It's also a lot of burden on state staff to be working the same household, having this many touches in a 12-month period, where they could definitely reduce the number of times they touch a client case. And all these contacts are lots of opportunities for things to go wrong, for a client not to return a form, for a client not to return a verification form, for a worker to lose the paperwork, for something to get lost in the process. And so how can we just streamline this to make it simpler for all parties involved? There are 4 more main strategies I want to talk about regarding opportunities for coordination. And there's different ways to think about these. One is to think about the different scenarios a family is going to face throughout their enrollment in these programs. Sometimes you're going to have a SNAP renewal due, but Medicaid not due. This is very common because, as we mentioned, most SNAP certification periods or most SNAP agencies require contact with the client every 6 months, whereas Medicaid is 12 months. So you're often going to have SNAP due and Medicaid not due. You're going to have other scenarios where just Medicaid is due. And then you're going to have scenarios where both SNAP and Medicaid are due. So these are 4 strategies, and each one is particularly applicable at a different scenario. So the first one is about using SNAP income data for Medicaid renewals. And this is similar to using a data source like the work number or talks or quarterly wage data, where Medicaid can ping the SNAP case file and see what income is recorded there. SNAP income information is particularly valuable because we all know it's very thoroughly verified and it's generally very recent, certainly much more recent than IRS data. So it's very reliable and useful for Medicaid. The second strategy is to align the renewal process when SNAP and Medicaid are due at the same time. For all those states who worked for so many years to synchronize the certification periods, you're going to have situations where SNAP and Medicaid are due, and there are some ways to kind of coordinate that process to make it more efficient. And then we've got some streamlined enrollment strategies as well as express lane eligibility that are applicable when Medicaid is due. And for both of these strategies, Medicaid is renewed based on the fact that somebody is enrolled in SNAP. In the first strategy, we're actually pulling income from the SNAP case, but in these strategies, it's the fact that they're receiving SNAP that allows us to renew Medicaid. So let's dive into these strategies a little further. So for the first one, we're using SNAP income data. What this allows you to do is to push forward the Medicaid certification when completing a SNAP renewal. And it's usually doing a Medicaid renewal early. So let's say you've got somebody who goes in for that 6-month SNAP renewal, but the Medicaid's not due yet. But as you process that SNAP renewal, you can actually push forward the Medicaid and do the Medicaid renewal early. This is allowable under ACA regulations. Some states were hesitant to continue this practice when the regulations were published because it says that Medicaid can be done no more often than once every 12 months. However, it also has a provision that talks about when certain circumstances are known to the agency that allows it to reevaluate eligibility, that it can do an early Medicaid renewal. So this is completely allowable and a very efficient process. Generally, there is some system or workforce integration required for this strategy because the Medicaid renewal has to happen after the SNAP renewal. There has to be some sort of coordination between the two systems. And it can be manual or automated. It might be that as the worker conducts a SNAP renewal, they also go into the case and conduct a Medicaid renewal, tell the system to renew Medicaid based on the SNAP information. Or it can be an automated process that when they do the SNAP renewal, it automatically takes consideration of the Medicaid case and extends that as well. One key thing here for states to look at is the structure of their interim report. So for the states that have that interim or periodic report, generally at 6 months, states generally ask a series of basic questions. Has anything really changed in your household? A change in your rate of pay, going from full-time to part-time, something like that. And if the client reports no, that they have not had any changes in their household situation, some states actually automatically process that interim report and continue the SNAP benefits for the subsequent months. They may have it, automated in their online eligibility system, or even something done when that interim report is scanned in. That's very valuable, and that can be a very big workload savings to a state to have these reports processed automatically when there are no changes. However, it does not allow you to push forward Medicaid if that interim report is automatically processed. A state has to check the electronic data sources in order to use that interim report to push forward Medicaid. So one option is for a state to run data sources on all interim reports it receives and check those and use that to renew the Medicaid when it's doing the SNAP interim report. Another option to kind of get the best of both worlds is take those interim reports where a client has reported a change. And that is going to be routed to a caseworker anyway to be worked for purposes of the SNAP renewal. So while it's routed to the caseworker, at that time the caseworker is going to check electronic data sources and can push forward Medicaid for those cases. So that kind of splits the difference and gets you the best of both worlds. Another thing that is required here is you would have to add Medicaid questions to the SNAP recertification form. Just a little bit focused on tax filing status to make sure that nothing has changed in the household composition for Medicaid. Small thing, definitely worth the investment. So another kind of variation of this strategy is when Medicaid is actually due to use SNAP income data to complete an ex parte renewal. So sometimes you're going to push forward Medicaid in conjunction with the SNAP renewal, but if it comes that the Medicaid is up for renewal and the SNAP is not up for renewal at that same time, you can treat that SNAP information like a data source, just like the Social Security Administration or wage data. And this can also be automated or a manual lookup. The state can ping the SNAP system, just like you would the Social Security Administration, and pull the income data and use that for an ex parte, or you can envision having a Medicaid caseworker looking at data sources, including the SNAP file, and manually looking this up to see what the income is recorded and using that for an ex parte. And as I pointed out before, this strategy uses the actual income data recorded in the SNAP case in order to renew Medicaid. And what's important to consider for all these strategies is they're strategies that are applicable in integrated and non-integrated systems. So just because your state might have a very separated system between Medicaid and SNAP doesn't mean there aren't opportunities. For example, what we just talked about, where SNAP is being pinged as a data source, that could be done even if your system is not integrated at all. So here is just some example of the questions that are added to a SNAP recertification form, basically asking if anyone, what the tax filing status is for the household. And this is just a little bit of additional information that is necessary for the state to also do the Medicaid along with the SNAP renewal. So strategy 2, there's the second option we're talking about, is aligning the renewal process when Medicaid and SNAP are due at the same time. Again, this is going to happen periodically, and states have an option of really letting Medicaid drive the process or SNAP drive the process. And definitely Medicaid driving the process is a much more efficient and compliant way of approaching this. So when Medicaid drives the process, the state first attempts the ex parte review for Medicaid, and that's usually done 60 or 75 days before the end of the certification period. If successful, they would send a form to the client informing the participant that Medicaid is renewed, but they need to complete and return this form for SNAP. It's important for that message to be coordinated. What you don't want is for the client to receive one notice one week saying that Medicaid's renewed, you're all set, you don't need to do anything. But shortly thereafter, receive a different form saying you have to return this form for SNAP. If you don't, we're going to cut off your benefits. That's obviously a very confusing message. So to coordinate this message together and say you're good for Medicaid, but you've got to return this form for SNAP makes it much clearer for the client. If the Medicaid ex parte renewal is not successful, then the state can send instructions to the client with a pre-populated renewal form that will count for both Medicaid and SNAP. So in this case, if the state has attempted the ex parte, they are unable to renew based on the ex parte review, then it kind of reverts to that older process of sending the form and requiring it to be returned and processed for both Medicaid and SNAP. But again, that does need to be pre-populated. That is required under the ACA. Some states try to have the second option where the SNAP drives the process, where they try to complete the SNAP renewal first. This is fine if they actually complete the SNAP renewal. If the client returns the renewal form and the interview is completed and everything, then the state can renew Medicaid along with SNAP. But if it's not successful, the SNAP ends and the state has to kind of quickly attempt an ex parte renewal. And this becomes problematic because often it results in the Medicaid extending a month beyond what it should, and it's fundamentally not compliant with the ex parte requirements that the state has to try the ex parte before actually going to the client for information. So we definitely recommend option 1 over option 2. And this is just a little bit of a flow chart to kind of explain the Medicaid-driven coordinated renewal process. SNAP and Medicaid renewals are both due, and the state attempts the ex parte renewal. If that's successful, we follow the blue path, leading to the notice going to the client saying that Medicaid's renewed, but SNAP renewal is due. If the SNAP form is returned, then the state renews a SNAP, and they may have to update the Medicaid case if new, more recent information comes in under SNAP. If the SNAP form is not returned, then SNAP case ends, but Medicaid continues, because remember, the Medicaid ex parte was completed, and so returning the SNAP form is not required for Medicaid in order to continue. Going back to the left side, if the ex parte Medicaid is not completed, then the state would send a notice informing the participant that they have to return this pre-populated form in order to continue receiving benefits. And if that form is returned, SNAP and Medicaid are renewed based on the information contained in that form, and if not, both SNAP and Medicaid can end at that point. The third strategies we're talking about have to do with streamlined enrollment, and these are particularly useful when Medicaid is due. So the first part of streamlined enrollment is something known as Strategy 3, and this comes from a set of some guidance that CMS put out actually before ACA implementation, designed to help states deal with Medicaid expansion. What this allows is for states to certify or renew households based on their enrollment in SNAP. It's a temporary option that has been put out in connection with ACA transition. It is still available for states to do, for states to request this waiver, but it is not permanent. It will go away at some point. And another caveat to it is that it requires a full MAGI redetermination within 12 months. So states may use this strategy to enroll a lot of SNAP recipients into Medicaid, often when they first enact Medicaid expansion. But because this full MAGI determination is required in 12 months, they can't use it on a perpetual basis. If they enroll the family using Strategy 3, they can't then use Strategy 3 to do the renewal 12 months later. Similarly, this can be useful right now for a lot of states that have a backlog of Medicaid renewals. They could get through that quickly by looking to see if the individual is enrolled in SNAP and using Strategy 3 to conduct this renewal. However, they can't then do another renewal for the same individual in 12 months using this strategy. It cannot be used perpetually. So it still has a lot of value, but isn't something that's going to be a permanent choice for states. What is permanent is a new state plan option that was released in some guidance in August of last year. And that allows states to certify or renew a certain subset of households based on their enrollment in SNAP. It's a little bit narrower set of households than under the Strategy 3 option, and it's limited to those folks that are determined to be certainly eligible for Medicaid based on their SNAP enrollment. But it is a permanent option, and it can be used for renewals on an ongoing basis. So you could enroll folks using the state plan option and then renew them perpetually using the same strategy as long as all of the criteria are met. Louisiana just utilized the state plan option in preparation for the Medicaid expansion, which takes place July 1st. And they've enrolled, I believe, over 100,000 individuals, a lot of their newly eligible population they've enrolled using the state plan option. So we look forward to working with other states who are interested in this, either for applications or for renewal. And the fourth approach is to use express lane eligibility when Medicaid is due. This allows states to certify or renew children based on their enrollment in SNAP, or it can actually be enrolled, expanded to other programs such as TANF or other benefit programs that have similar eligibility requirements. Some states, actually one state that we know of, has expanded this to adults through an 1115 waiver, but for most states this is going to be limited to children. It can also be used for an early Medicaid renewal. It could be a strategy used after a SNAP renewal is completed to essentially push forward the Medicaid. It may require some tailoring in states with expanded gross income limits for SNAP. A state would have to look at where their children's Medicaid eligibility is set in comparison to where their SNAP eligibility is set if the state has expanded the SNAP gross income limit. It doesn't prevent you from using this strategy, but there's a little more analysis that has to go into it. Express lane eligibility is great for any state, but it's particularly ideal for states with minimal integration. Even if the systems are totally separate and don't talk and have separate caseworkers and all of that. ELE can be implemented by the SNAP or the TANF agency, producing a monthly list of enrollees, and then a Medicaid agency checking children who are due for renewal against this list. If those Medicaid children due for renewal match that they're currently enrolled in SNAP or TANF, this agency can automatically renew if that match is found. So again, minimal integration is required. So when you're looking at what option fits your state, it's important to look at how closely linked SNAP and Medicaid are. Again, there are options available for any of these situations, but it does matter a little bit where your state lies. So in some states, SNAP and Medicaid, same agency, same caseworker, same eligibility system, they're very closely linked. In others, there's a little more distance between them. Perhaps it's the same caseworkers, but different eligibility systems, something like that. And then, of course, we have states where SNAP and Medicaid are completely different. They are in different eligibility systems, different workers, different agencies. And so we're going to go through two examples here to look at how you can apply these different strategies. The first example is looking at an integrated state, where the state has an integrated eligibility system and a workforce. And this outlines how we can apply those four different approaches depending on what scenario a household might face. So if a SNAP case is due, a SNAP renewal is due, but Medicaid is not due yet, the state can check the data sources for all the interim reports and push forward Medicaid when they conduct a SNAP renewal. And just to be clear, when a state is doing a full SNAP redetermination, the full process, not the interim report, but the full yearly process, you can always push forward Medicaid when you're conducting that full renewal. And again, this would require adding those Medicaid questions to the SNAP form, but once that is done, you can push forward Medicaid whenever you're touching a SNAP case for renewal. Looking to the right, when Medicaid is due and SNAP is not due, this should be fairly rare if the state is consistently pushing forward Medicaid with a SNAP recertification, because remember, you're going to touch a SNAP case every 6 months, but Medicaid will be certified for 12 months. So if you push forward Medicaid every 6 months, a Medicaid-only renewal is never going to come due. But there are, of course, situations where things do get out of sync and a Medicaid renewal may come due. And in this case, it's great for the state to conduct an ex parte renewal using the income data from the SNAP case. And again, there are still going to be situations where both SNAP and Medicaid are due. And there you want the state to attempt an ex parte Medicaid renewal and then send an appropriate instruction based on the result. As we talked about earlier, if the Medicaid ex parte is successful, then you say Medicaid is all good, you got to return this form for SNAP. And if the ex parte Medicaid renewal is not successful, then you send a joint pre-populated notice that the client has to return for both SNAP and Medicaid. Looking at a state with minimal integration, for example, SNAP and Medicaid are in different eligibility systems and administered by different workers. Here, when Medicaid is due, there are a couple of options. One is to complete the ex parte renewal using the income data from SNAP. Again, SNAP is a data source. Ping that SNAP file just like you might ping quarterly wage data. Another strategy is to automatically renew children on SNAP using express lane eligibility. This will get a good chunk of the population, at least get those children taken care of and get them renewed as long as they're on SNAP as well. And another option to go beyond children is to automatically renew a subset of SNAP recipients using that state plan option. That allows you to capture a larger group, including adults, and treat them almost like ELE, where you're automatically renewing them based on enrollment in SNAP. Even if you apply all those strategies when Medicaid is due, you're still going to have some situations where SNAP and Medicaid both come due. And then it's really important to coordinate the message. What you really don't want a household to receive is these two conflicting notices, days or a week apart. You know, you have to do this for Medicaid, you have to do this for SNAP. It can lead a household to return forms to the wrong agency, to think they responded to one form and that they're all set for the other program, whatever it might be. So however that message can be coordinated is important. And where possible, it's great if a state can share the renewal forms or the verification documents that are submitted, so that if somebody returns a form for one program or wage stubs for one program, that it can be used for both programs to minimize the burden on the client and to reduce procedural denials. So what's next for an advocate or for a state agency looking to implement some of these changes? One thing is to look at the metrics that are currently available around renewals and churn, to look at what's produced, what's publicized, what's actually used by the state or county staff. In many state agencies, there are a lot of great reports that are produced regularly, but no one actually looks at them and takes action to try to improve those numbers. So see what's out there. It's also great to look at what is the current process, and that requires looking at both policy and operations. With this process, just like so many things out there, often policy might be in a great place, but it's not being implemented as envisioned. It might be that the eligibility system isn't treating things how you thought it was. It might be that caseworkers don't have a complete understanding of what they're supposed to do. And so we found in doing research for this paper that in a lot of states there was a little bit of a divide between what central office staff thought was happening and what was actually happening on the ground. And also, it might be important to make the case, especially if there have to be system changes, if it costs money, whether you're an advocate on the outside or whether you're within a state agency advocating for some of these changes. It's important to point out that this is not saving money. People are going to come back. They're not going to decide that they don't need SNAP or medical benefits. They're going to come back. And this churning does lead to a significant increase in workload. As Suzanne identified, it can cost $80 per case every time a family churns. So reducing this by a few thousand really makes a big difference. Now, you're going to encounter some opposition, again, within an agency, as an advocate, or as a state worker. And a lot of times people think that the state, doesn't have a lot of responsibility because sometimes people just don't respond to notices. There's nothing the state can do about that. That's how I perceived things when I was a state administrator. I thought, hey, we sent out a notice. If they don't respond, there's nothing that can be done. But the truth is that there are a lot of things that are within the state's control. Was a notice clear? Did the family receive the notice? Is the address updated in the system? Could they have been notified or reminded in a better way, whether through a text message or a robocall or electronic notice? And fundamentally, should they have been required to send something in? Could the state have conducted a successful ex parte Medicaid renewal? Did they have to ask for that actual verification document, or did they already have it on file? There's a lot the state can do. Also, states might think that they've coordinated their renewals. Their certification periods are aligned, so they're all set. But that's not true anymore. ACA changed things, and now just sending out one form for both programs doesn't cut it. There are a lot of good options still available, but states need to dig into this and figure out what works best. States also might think that they don't have enough staff to chase people down and remind them and call them personally to respond to renewal notices. But that's not what these strategies are asking for. These strategies are actually ways to increase efficiencies that will reduce workload and make things better for the clients. Sometimes you'll get opposition from legislators or others that this is all about expanding access and getting more people on benefits. And the truth is it's not changing eligibility at all. It's about keeping eligible people on and in the process reducing work for your staff. And finally, agencies may have taken some responsibility for this process before if they were losing paperwork or had very inefficient processes. Perhaps they've cleaned that up and they think we're done, we've done our part. But as we see, there's a lot more that an agency can do to implement these strategies and create efficiencies. So with that, let's move on to questions.
Great. Thank you so much for all that information, Jen. So we have had some questions coming in, and we'll get to as many as we can in the time that we have remaining. For the first question that has come in, the question is, when SNAP is due but not Medicaid, and you try to push forward Medicaid, if the SNAP renewal is not completed, will it affect Medicaid coverage?
That's a great question. No, that's important to kind of distinguish here, because when states try to integrate these processes, they might sometimes impose incorrect requirements on the other program. So if a SNAP renewal is due, but Medicaid is not due, and the client fails to complete the SNAP renewal, they don't send in the form, they don't complete the interview, that should have no effect on the Medicaid case. The Medicaid case is still certified for their 12 months. The SNAP may have to end, but the Medicaid case will continue. So you're only going to push forward Medicaid when the SNAP renewal is actually completed. Now, along with that, if during the SNAP renewal you find that the person's no longer eligible for Medicaid, depending on continuous eligibility provisions in your state, you may have to take action on the Medicaid case there. But the Medicaid should not be ended early just because they failed to complete the SNAP renewal.
Great, thank you, Jen. Our next question I will pose to both Jen and Tricia, for whoever would like to take the first stab at it. The question is, who are the best people to begin asking about the status of a renewal process in your state?
Do you want to go first, Jen?
No, go for it. Take a stab.
Well, it definitely varies in terms of who the best person is. If indeed you have any kind of a routine process whereby state folks meet with your health policy coalition, you could certainly start there. I mean, certainly starting with someone that you know is on the policy side of things is a good place to start, but that isn't always the person that gets into the nitty-gritty. I think it's also helpful to perhaps go to some very seasoned consumer assisters or people who do presumptive eligibility, because they have probably learned a lot about how the process is working, and being able to take those lessons learned back to state policymakers is really important to say. You may think, I mean, as Jen pointed out, a home office often thinks we laid out the policy, this is the way it's supposed to be done, but it isn't always being done at the caseworker level in that way. So I think it just really depends on the state.
Thank you, Trish. Jen, do you have anything you'd like to add?
Just to echo what Tricia said, whoever you have a contact with, whether you're interacting with people at the local office level, to ask them what the process is and how it's working and where they run into obstacles. If you have contacts with policy people or central office operations people, any of them should have some information, and there's different arguments you can make to each audience. At the local office level, at the operational level, pointing out some opportunities to increase efficiency and decrease workload for the staff, to lessen the number of phone calls coming in saying, did you get my paperwork? Why wasn't I renewed? That can be persuasive to them. On the policy side, it might be more about retention. At a higher level administration, it might be about saving money from this unnecessary churn. So wherever you have contacts, you can get information and you can make arguments for how to make these changes.
Great, thank you. Our next question is for Tricia. The question is, are there repercussions for states from CMS if the state is not implementing ex parte renewal process correctly? For example, if they're sending a pre-populated renewal form to everyone, not just those who they can't renew with electronic resources.
Well, let's talk about that pre-populated form first, and then I'll come back to CMS compliance. There are a number of states, I don't know, I mean, not a large number, but there's definitely some states that are sending out something to everyone. And I will say that at least my knowledge of those tend to be more state-based marketplace states that say, we really want people to see the information we have on file and to update it. We think it's important that we not, do this on a passive basis. At the same time, if there are no changes, people are not required to return those forms. CMS has basically given their blessing that that's okay, that they can do that. The problem is other states will argue that, well, it just means people send it back in and somebody has to take a look at it only to determine that there's no change, and that's not even efficient for us. So that one, I think, is sort of the jury is still out, but I don't think CMS is going to come down on that practice as long as the state then proceeds with that ex parte renewal if they can, whether the individual responds or not. I think that CMS on the compliance side has certainly been trying to work collaboratively with states and understanding of the heavy lift that they had. And that in particular, at first we had to get the single streamlined eligibility system up and running. We had to move to MAGI-based policies on both income and household counting, and that the technology side of things has not gone as smoothly as states expected, and therefore sort of this understanding that there's this trickle out or chronological order of things that needed to be done in the state, and therefore you sort of got to renewals at the end. It is my understanding that CMS is there, there's certainly they have some states on a watch list that they've notified in writing that they are expected to come into compliance, but as yet I've not seen any threats of sanctions or for those states. I do know that CMS is working very hard to get any state that's not doing ex parte off of whatever mitigation strategy they have in place currently. I think that in terms of real compliance, it's going to fall into the next administration.
Great, thank you, Tricia. I think that is going to be our last question for the webinar. We are right at the hour mark. We'd like to thank everyone for joining us today, and just a few housekeeping items wrap up. As a reminder, we will post a recording of the webinar on the CLASP website under the ASAP project, and we will also post a PDF of all of the slides that people will be able to access. If people have questions that they did not have answered on the webinar, they can feel free to send those to myself, Weichel, which is just SWIKLE@clasp.org, and we will make sure that that gets routed to the right person for an answer. Thank you very much to Tricia and Jennifer for participating on this webinar, and we hope everyone has a wonderful afternoon.